All right, let's talk about AI and healthcare. Today, we're going to cut right through all the noise and look at how this tech is actually tangibly changing things, from a patient's bedside all the way to the operating room. So let's see how this is moving from just an idea into real-world practice. Every single day there's a new headline about AI. But what does that really mean inside a hospital? In this explainer, we're going to break it down with 4 concrete examples that show how AI is getting real. We'll see how it's talking directly with patients, giving doctors superpowers, automating entire hospital tasks, and even training the nurses of tomorrow.
So first up, let's start with the most personal part of all this, the patient experience. Believe it or not, AI is now becoming a direct point of contact, a guide for people when they're going through a really stressful time.
Just imagine you're about to have surgery. You've got a million questions bouncing around in your head, and your anxiety is probably through the roof, right? Well, at the Ottawa Hospital, they're trying out something really fascinating, an AI avatar that basically becomes your personal guide through the entire journey.
And look, this is way more than just some basic chatbot. These things are called frontline AI teammates. It's a collaboration between Deloitte and NVIDIA, and they're built for natural, human-like chats. By giving you solid answers anytime, day or night, they can seriously lower a patient's stress. But the real win here? It frees up nurses and doctors from answering the same questions over and over so they can focus on the complex, hands-on care where they're needed most. Okay, so AI is helping patients directly. That's cool. But what about the clinicians? Let's jump to our next section and see how AI is basically augmenting the experts, giving them incredibly powerful new tools to work with behind the scenes. You might see a term like NVIDIA Monai, and your eyes might glaze over thinking it's super complicated. But the idea behind it is actually pretty simple. Think of it like a powerful toolkit that helps hospitals and developers get the latest AI for medical imaging, for analyzing X-rays or CT scans, out of the research lab and into a real hospital fast. So here's how that actually works. A company like Siemens Healthineers might build a really amazing AI model, like one called Vista 3D, which can map out 3D images from CT scans with incredible precision. The problem is, getting that tool to actually work inside a hospital's existing system is usually a huge headache. A platform like Monai is the bridge. It makes plugging that new technology in totally seamless. And what you get is faster, more accurate diagnostics and a much, much smoother day for the clinicians. So far, we've pretty much been talking about AI as software, digital assistants and smart analysis tools. But its impact is about to get a lot more physical. It's actually starting to change the hospital environment itself.
Yeah, we're moving way beyond just code running on a server or a computer screen.
Because now, intelligent, autonomous robots are literally becoming part of the hospital team. A huge move here was when Symbotic, a company known for its giant warehouse automation systems, bought a robotics company called OmniLabs. Now, why should you care? Because Symbotic knows how to build things at a massive scale, and OmniLabs brings the specialized AI vision and nimble mobile robots. You put those two together, and you get new solutions for things like robots that can disinfect rooms on their own, or telepresence bots that let doctors do virtual rounds. It's about streamlining care in a totally new way. Okay, so with all this incredible new tech flooding into hospitals, a huge question pops up. How on earth do we prepare the next generation of healthcare workers to actually use all this stuff? Well, to answer that, Florida State University has done something groundbreaking. They've launched the nation's very first master's program specifically designed to get nurses ready for the age of AI. And let's be clear, the point here isn't to turn nurses into computer programmers. Not at all. It's about empowering them to be clinical leaders who know how to strategically bring these AI tools into their daily work. It's all about driving innovation from the people who are actually on the front lines, with the one and only goal being better outcomes for patients. So as we've seen, this isn't just one thing happening in one corner of the hospital. From the patient's bedside with those digital avatars, to the doctor's desk with smarter imaging, all the way to robots in the hallways, AI is really being woven into the very fabric of modern healthcare. And all of this leads us to the one big question that's on everyone's mind. What is the ultimate role for AI in medicine? What does the future of care even look like now?
Well, public opinion is still figuring that out. A lot of people see AI as an absolute game changer, but there's also a lot of caution out there. But look closely. There's a common thread, no matter what people think. It's this strong belief that no matter how smart the technology gets, the human touch has to stay at the absolute center of patient care.
These tools are incredibly powerful, but at the end of the day, that's what they are, tools. As AI gets more and more integrated into our lives, the real challenge isn't just about the tech, it's making sure that every new application is designed not to replace human judgment, but to enhance our humanity. So the question we're all left with is, how do we make sure we build that future?